Segment 4, healthcare. This past spring, just after the passage of the new healthcare legislation, let's call it ObamaCare, I interviewed you for the Wall Street Journal. You said, quote, "It's a bad bill. Healthcare in the United States does have a number of weaknesses. This bill doesn't address them. It's going to increase health costs, not contain them." Increase costs. Why?
Well, there are a number of things in the bill that are cost increasing. I'll start with one major one. We had 45 million people who didn't have health insurance. Mainly these were young people. These weren't sick people. Couldn't get, well, there were a few of those, but they were mainly young people who made a calculation. They're pretty wealthy and they didn't have it. Okay, we brought them in. Now, there are ways to bring them in that I might have supported, but we brought them in a very bad way. Instead of giving them a minimal catastrophic health care plan, which is one that could make some sense, we gave them we require them, not just gave them, require them to have a pretty generous plan, and we raised the poverty level for which they would get subsidized by the government from simply the ordinary poverty level to like 3 times the poverty level. I don't remember the statistics now in my mind, but it was something like that. That's going to be a big force expanding overall medical spending. Secondly, one of the weaknesses in the American healthcare system, it's too employer-based. Employers get subsidies for providing insurance. We're one of the few countries in the world that have mainly an employer-based insurance system. Instead of sort of taking that away, which would have been the right approach to do it, we expanded it. In fact, we now institute a system where we're taxing small businesses if they don't institute a health care bill. Now, I hear from some small businesses they'll prefer to pay the tax than do it because they're obligated to have an expensive plan that they'll be liable for. But that's another cost-increasing one. We did very little, if anything, to reform Medicare other than maybe having a lot of rationing and so on in Medicare. What we should have done is made individuals responsible for a larger out-of-pocket share of their total expenses at all levels, including Medicare levels. Switzerland, my favorite example, Switzerland has on average 30% of total medical expenses are out-of-pocket. That is, they're paid for by the individual, either in terms that they take a big deductible or they have a big co-payment. The U.S. average before the passage of the bill was around 12%. The bill doesn't change it in any significant way.
Gary,